David Hurley, the Governor-General of the Commonwealth of Australia, Stroke Foundation Board of Directors, our President, Jim Angus, distinguished guests, and to all our stroke community. It's my enormous pleasure to welcome you all to the launch of the Economic Impact of Stroke 2020 report this morning. My name is Sharon McGowan, and I'm the CEO of the Stroke Foundation. I'd like to begin by acknowledging the traditional owners of the land on which we're gathered here this morning, and here in Melbourne, that's the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present, and those emerging among us. I would also like to pay my respects to any elders from other communities who may be represented around our virtual room this morning. Thank you all for joining us for the official launch of this important report, which demonstrates the significant value and opportunity to invest in stroke prevention and equitable access to stroke treatment and stroke unit care. Commissioning the Economic Impact of Stroke 2020 report and its companion report, No Postcode Untouched 2020, is a significant undertaking for the Stroke Foundation. As an evidence-based organisation, we ground our work in the facts. We plan our services according to the community's needs and advocate passionately for the interventions that we know can save and improve lives. These two important reports will underpin the direction of our work for many years to come. The record attendance at today's event is testament to the importance of these reports within the community. Almost 300 people registered to attend today's events, which is many more than we would have had if we'd held this event in person. So there are some advantages to being virtual this morning. Today, I'm pleased to be joined by a fantastic panel of speakers to discuss and comment on these reports. I'm delighted to introduce you now to our panel of speakers. I'd like to formally welcome Their Excellencies, the Governor-General of the Commonwealth of Australia, General the Honourable David Hurley and Mrs. Linda Hurley. His Excellency, General the Honourable David Hurley, AC, DSC, was sworn in as the Governor-General of the Commonwealth of Australia on the 1st of July 2019. His Excellency joined the Australian Army in 1972, graduating from the Royal Military College, Duntroon, into the Royal Australian Infantry Corps. In a long and distinguished 42-year military career, his service culminated with his appointment as Chief of the Defence Force from 2011 to his retirement in 2014. In 2010, he was awarded a Companion of the Order of Australia for eminent service to the Australian Defence Force. Prior to being sworn in as the Governor-General, His Excellency served as the 38th Governor of New South Wales from 2014 to 2019. As Chief Patron of the Stroke Foundation, we are honoured that His Excellency, General the Honourable David Hurley, has joined us to officially launch the Economic Impact of Stroke report. I'm also delighted to welcome and introduce Her Excellency, Mrs. Linda Hurley. Her Excellency, Mrs. Linda Hurley, has a Bachelor in Education and has supported her husband throughout his career on a wide range of postings in Australia and overseas, including the United States, the United Kingdom, Germany, and Malaysia. Her Excellency had her own career in education in both the public and private systems, until her retirement from full-time teaching in July 2011. She has a keen interest in the arts and is passionate about singing and showing how singing, especially in a group, can have a positive impact on individuals and the community. And I think, and I hope you don't mind me sharing, that Mrs. Hurley just shared with us how she has sang with a stroke choir. And I just think that's so wonderful and such a wonderful story to share with the community today. We all know how aphasia is such a challenge in terms of stroke recovery and how singing can be an important part of someone's recovery. So it's just wonderful that you've had that experience yourself, Mrs. Hurley. Thank you so much for sharing it with us. We are absolutely privileged to have you both here with us this morning at this important event. This morning, you'll hear a lot about numbers and dollars, but behind each one of these figures is a person, a family, and a community impacted by stroke. We are therefore incredibly grateful to be joined by Bill and Denise Vernon from Western Australia. Bill had his stroke in 2013 at the age of 53. They were living and now live again in the regional community of Collie, at the time of Bill's stroke. Bill and Denise will share with us their experience and why this report and the interventions we have modelled are so important and have the potential to change the course of this disease for future generations to come. Our third speaker this morning is Professor Amanda Thrift, Head of Stroke and Aging and Senior Research Fellow at Monash University. Professor Thrift is a member of the Board of Directors of the Stroke Foundation and Chair of our Research Advisory Committee. She's a past president of the Stroke Society of Australasia and sits on numerous national and international advisory groups. Professor Thrift gained her PhD from Monash University in 1995 in epidemiology in the study of risk factors for intracranial hemorrhage. She has considerable research expertise in the epidemiology of stroke, having led the influential Northeast Melbourne Stroke Incidence Study. This study has provided much of the evidence base for policy decisions around stroke in Australia. Her current portfolio of research includes NHMRC funded studies in the implementation of secondary prevention of stroke and vascular disease, and studies of causal factors for vascular disease and hypertension in low and middle income countries. In 2017, she was recognised for her work via receipt of the Excellence in Stroke Award, the highest honour awarded by the Stroke Society of Australasia. Professor Thrift will guide us through the findings of this report. Finally, this morning, we will hear from Minister for Health, the Honourable Greg Hunt MP. Minister Hunt, unfortunately, was unable to join us in person today, but has sent a video message which we will share with you. We welcome the government's ongoing support for Stroke Foundation and commitment to improving the health and well-being of all Australians. Today's panel will not be taking questions live during the event. However, we do have members of the Stroke Foundation team on standby to answer your questions as they arise. You can post these questions in the Q&A function on your screen, and we'll try and answer them during the session. Alternatively, we'll come back to you by email for anything that we can't answer at the time. If you do have follow-up questions after today's event, please do email them to us at ceo@strokefoundation.org.au, and we will come back to you. Please note also that today's session is being recorded and will be posted on our website. For those of you that may want to watch it again, share it with your friends, your colleagues, your elected representatives and family members. I would now like to invite His Excellency General, the Honourable David Hurley, to introduce the Economic Impact of Stroke Report 2020.
Sharon, thank you very much. And I begin by joining you in acknowledging the traditional owners of the land, the many lands that we're meeting and sitting on today, and pay respects to elders past and present. Could I acknowledge Professor James Angus, the President and Non-Executive Director of the Stroke Foundation, Professor Amanda Thrift, the Head of Stroke and Aging Research at the Stroke Foundation, of course, Bill and Denise Vernon, and thank you for sharing your story today, members of the Stroke Foundation and guests joining us online. Linda and I are delighted to be with you for today's launch of the Economic Impact of Stroke in Australia 2020 report. I want to acknowledge the wonderful work of the Stroke Foundation in advocating on behalf of the stroke community and for improved health outcomes, and to thank Deloitte Access Economics for compiling this report. The report provides a quantified analysis of the cost of stroke in Australia. We know the human cost, the individual stories, but thanks to this report, we know the cumulative economic and societal costs. This report will be enormously valuable. Stroke attacks the brain and changes lives in an instant, lives that are forever altered for both the individual who experienced the stroke and their loved ones. One stroke occurs every 19 minutes. That means 3 Australians will experience a stroke for the first time in their lives during the course of this event. Stroke does not discriminate. While this report quantifies the impacts of stroke, it's important to recognise that behind these numbers are real lives, survivors of stroke, their family, carers and community. And shortly we'll hear from Bill and Denise Vernon, who will share their very personal stroke experience with us. This report contains rich data that will help guide the Stroke Foundation, governments, health services and researchers into the future. It will help inform debate and the development of public policy. I again commend all at the Stroke Foundation and Deloitte Access Economics for producing this report. Stroke can be prevented and it can be treated. Innovations in treatment means stroke is no longer a death sentence, but for survivors of stroke, the recovery journey can be long and challenging. It requires a whole of community effort. Thank you to all of you, clinicians, health professionals, researchers, the Stroke Foundation board and committee members, supporters, staff and volunteers for the work you are doing to help prevent stroke, save lives and enhance recovery. It is now my great pleasure to officially launch the Economic Impact of Stroke in Australia 2020 report. Thank you and congratulations.
Thank you, Governor General. We are so honoured to have your ongoing support as our chief patron of the Stroke Foundation. High-profile individuals such as yourself sharing important messages about stroke is vital to raising awareness of this disease, its impact, and the opportunities that we have to address it. Your support in the peak of the coronavirus pandemic and in National Stroke Week has been greatly appreciated. Many of you will not be aware, but the Governor General actually reached out to every single charity for which his office is a patron during the pandemic and offered to help. It was an extraordinary act of generosity. And of course, I said it would be wonderful if you would tell the community about the fast signs of stroke. And the Governor General has done it on 2 occasions for us. So we are so honoured. It was such a privilege to talk to you on that, but such a generous gesture to all of your charities. Thank you. Thank you again for your attendance today and your continued and ongoing patronage. We look forward to continuing to partner with you. And now it gives me great pleasure to invite Bill and Denise to speak. This is really what this report is all about and what we seek to address. So Bill and Denise, thank you so much for joining us this morning. And it's very early for you in WA, so we really appreciate you making the effort to be up early for us.
Thank you. We're really honoured to be here and to tell Bill's story. On the 5th of December 2013, at 1 o'clock in the morning, Bill spoke to me, or leading up to that, nothing looked like we were going to have a different night. We went to bed, no headache from Bill, no nothing. And anyway, 1 o'clock in the morning, Bill spoke to me and I thought, oh, that didn't sound like Bill, sounded like we had somebody else in our room. And Bill went to stand up and fell. And that was the start of our journey. So I quickly sort of got to Bill and realised straight away that something wasn't right. And at the time I had my 18-year-old youngest son. We have 5 children in the house with us, and I was able to get him in the room. I dialed 000, and we, living in the country, which I thought was the greatest thing on earth, and still do, though our ambulance was at our door and we had Bill in the hospital within 25 minutes from the time he hit the floor. So we thought everything was going good for us. And I said to the ambulance officer, is Bill having a stroke? And he thought that he was. Bill, at this stage, Bill was paralysed and looking very scared, very down one side, yeah. So we got him into the hospital and we had a young doctor come to the emergency service. And by this stage, our 5 children were at the hospital also. So we're still under an hour at this stage. And the doctor came in and he was very unsure, really unsure, and he was very young. And we had 2 nurses there and everybody was sort of running, and Bill was just deteriorating really fast. And at that stage we thought, oh God, he's really not going to make it. He couldn't speak. His face had dropped. Everything about him had changed in minutes. And the doctor, to our knowledge, called another hospital, but came back and said he couldn't confirm whether Bill had had a stroke at that stage he said, I don't know whether Bill's had a bleed or a clot, so we don't know what to do. And I said, well, can we go somewhere else? And he said, well, we'll just put you in a room tonight and we'll see how he is in the morning. And so from there, we're still under an hour of Bill having his stroke. And they decided to wheel us down into a little dark room in the Collie Hospital, little country hospital. And there we sat. Well, I sat with my 5 children. Well, Bill just looked so panicked, and we were still trusting everybody, thinking that this was going to be all right. And anyway, they came in and said to us, well, we might send you to the Bunbury Hospital about 8 o'clock in the morning. By this stage, it was 4 o'clock. And I asked them, why couldn't we go now? And I think they really thought that Bill wasn't going to make it, and we did too. We thought we were there. That was it. That was going to be Bill's calling. And next thing you know, 6 o'clock arrived, and everybody went into panic. I think we had a senior doctor arrive at the hospital, but we didn't get to see anybody. They just shipped us straight into an ambulance, and we were straight down to Bunbury. And in my knowledge now, I don't know why they didn't get the chopper in and land it and get us out of there. And what we know now, I've got 5 very strong children. We would have carried Bill in a car and gone on our own to Perth. So we arrived in Bunbury, and we had just by chance, a neurosurgeon was there, and she took one look and confirmed what we already knew, that Bill had suffered a massive stroke. And by the time he'd had his scans, he'd suffered numerous strokes and was going downhill fast. So then they decided that they would chopper him to Perth. So from there, by this stage, it's 12 o'clock in the afternoon, midday, a good 13 hours since Bill had had his stroke. I've still been given nothing. And off Bill went to Perth, and they told us to say goodbye to him there because we probably might not see him again. Off Bill went, and we all drove to Perth and got to Perth, and that from there things were happening pretty fast, but they told us that he wasn't going to make it and that we should say goodbye. But that wasn't on our agenda, and I don't think it obviously wasn't on Bill's either, because he was, leading up to this, Bill was a very strong, fit man who rode 25 kilometres a day on his push bike, would ride to work, ride home from work after doing a 12-hour shift. And we knew he had this fight in him. He was a very fit 53-year-old man. And so we just said, no, we're not doing that. We're going to fight. And from there, we did a fight. And at 6 days into the in Royal Perth Hospital, Bill was still connected up to all his machines, but we had an opportunity to go to what they then called Shenton Park Rehabilitation Centre. It's closed down. Bill was one of the last patients there. And they sent us to Shenton Park. And from there we went through. Bill couldn't speak. He couldn't walk. He couldn't remember anything. He couldn't remember our kids. He couldn't remember my name. And today we fight that, don't we? Mm. And yeah, it's not the life we wanted. Bill will never walk again, never work again, but he's here. But has an acquired brain injury. Yeah.
Thank you so much for sharing that story, Denise. And it is just devastating to hear it. And just that, all those opportunities which, could have happened and things could have been different. So you knew when, we talk about stroke being a chain of survival. We talk about, somebody in the family recognizing that it's a stroke and calling the emergency services, and everything you did at the beginning, happened as it should. And then everything after that just didn't. So,
no.
That's definitely the experience that we are aiming to make sure it doesn't happen to people, particularly in regional and rural areas. But clearly, Bill, you are a fighter. After all that, you were like, I'm not sitting down for this.
No.
So well done you. Well done you. And, you know, I can only say, you know, that fighting spirit is clearly still there. So, you know, keep going. This is, you know, that sort of resilience and that, you know, absolute drive to continue your recovery is so commendable. You're, you know, just inspiring from that perspective. How are your children?
They're really good. So since we've got 5 children, they've all married in this time now, and we already had a couple married with a few kids. Now we've got 15 grandchildren.
Wow.
At the time we had 3 or 4 we had and a half. Our children, we couldn't have done it without them. Sort of even in Bill's therapy, our boys used to lay on the ground and move Bill's feet, and we'd have the physios holding him up. We were determined there was no way he was going to be in that wheelchair, I can tell you. And to Bill's credit, 6 months later at Shenton Park, he took his steps out of that ward, and we were determined we weren't going to wheel him out. He was walking out. I'll give you the big tip. But, you know, sort of we knew all along, right from the moment he hit the ground, that it was a stroke, but nobody would confirm it in our local hospital. But what I know now, in my experience now, I'm so sad and sorry that I didn't stand up and say, I want him out of here. We had rights, but we weren't given them. They truly thought he wasn't good. He was unrecognisable, and I think they didn't think he was going to make it out of the Collie Hospital. That was the dead set truth.
But you knew better. You know him.
We did. And
good for you.
Even in our rehabilitation in Perth, they told us 2 years and Bill would not, there would be nothing else from there. Bill is still learning. Bill's learning to count, to read. He couldn't do any of that, and now he can read a few lines and he can count. So these are all, you know,
they're all steps forward. They are. Well, with all of those grandchildren, that's a memory test in itself, Bill.
He doesn't know any of their names, do you?
Bill.
Yeah, well, just recently we've just had a grandson born. He's 5 months old, and I think it started out as a joke to start with. It was my son's 4th son, and he said, Dad will never forget this name, and he named him Billy. So he does remember that name.
Sounds good to me.
Yeah.
Well, you'll know our vision in this organisation is a world that's free from disability and suffering that's caused by stroke. And we want to ensure that families like you never have that experience again. And we're certainly on a mission to make sure that that happens, so that we actually get equitable access to emergency stroke treatment in all parts of Australia. So on that note, I think it is important for me to acknowledge and thank the Australian government for their commitment to a statewide telestroke service in Western Australia. During Stroke Week this year, they committed $9.7 million to implement a statewide telestroke service, which will enable regional and rural hospitals to have access to a stroke specialist 24/7. And I think that has the potential to really change and improve lives for any Western Australian resident that may be affected by stroke in the future. But as Amanda Thrift will show us, actually access to emergency stroke treatment through telestroke is just one of the many opportunities that we will have to improve outcomes from stroke. So before I invite Professor Thrift to detail the report's findings, the following short video provides a snapshot of the high-level findings of the economic impact of stroke report. Thank you both, Bill and Denise.
In 2020, 27,428 Australians will experience stroke for the first time in their lives. By 2050, these numbers are expected to almost double to 50,600 strokes. The direct economic cost of stroke is more than $6.2 billion, with a further $26 billion in lost wellbeing due to disability and premature death. Improving access to stroke care and reducing high blood pressure has the potential to save $2.6 billion annually in economic and wellbeing costs. Stroke can be prevented, stroke can be treated, Stroke can be beaten. In 2020,
I'd now like to invite Professor Thrift, Chair of Stroke Foundation's Research Advisory Committee, to present the findings from this report.
Thank you so much for your kind introduction, and I'd like to start by respectfully acknowledging the traditional landowners on the land on which we meet, noting that they're all different lands. I'm on the lands of the Wurundjeri people, and I'd like to pay my respects to their elders past, present and emerging. I'd also like to acknowledge their excellencies, the Honourable David Hurley and Linda Hurley, and the President of the Stroke Foundation, James Angus. And thank you so much, Bill and Denise, for your inspiring story. I hope that what we can achieve in the future will prevent some of these from happening in the future. So Deloitte Access Economics were commissioned to update the economic impact of stroke in Australia report, and this was last published in 2013. This report quantifies the economic and wellbeing impact of stroke on the health system, aged care and disability services, the economy and our community. This highlights the potential cost savings that can be realised by investing in preventing stroke, timely treatment and care. And it captures the real impact of stroke on individuals due to short and long-term disability and premature death. No report commissioned in 2020 can really avoid noting the impact of the coronavirus pandemic in Australia and across the world. While the data contained in this report do not take into account the impact of the pandemic, COVID-19 will undoubtedly affect its results, as there is emerging evidence that COVID-19 is having both an indirect and a direct impact on stroke in Australia. For example, there is evidence that people are delaying trips to their doctor for health checks and chronic disease management. People are delaying calling 000 in emergencies, and the continuity of care for stroke has been disrupted. There's also emerging evidence from the United Kingdom and the United States of a link between COVID-19 and stroke among younger people. The cost of stroke is not only felt by individuals, but by their families and carers, government and society as a whole. The total economic cost of stroke in Australia in 2020 was estimated to be $6.2 billion. Productivity losses were the largest at $2.9 billion, and these resulted largely from premature mortality, time off from work and less employment compared to the general community as a result of their stroke. When the Stroke Foundation commissioned a similar report in 2013, the economic impact of stroke was then estimated at $5 billion per year. Today, it has increased markedly. Importantly, this report demonstrates there's a significant value in investing in evidence-based actions to reach achievable benchmarks in stroke prevention and equitable access to timely treatment. This includes savings of $179 million in economic costs and savings of $2.4 billion in reduced mortality and improved wellbeing over 5 years. Let's just drill down a little bit more into these numbers. In 2020, there were an estimated 445,000 survivors of stroke living in the community. There were 27,400 Australians who experienced stroke for the first time in their lives in 2020, and this equates to 1 stroke every 19 minutes. Rates of first ever stroke have declined over time, particularly in people aged 65 years or older. So there is a bit of good news. There were an estimated 8,700 deaths due to stroke in 2020, and mortality from stroke has declined over time, although this trend seems to have steadied over the last 5 years. The incidence of stroke has been declining in Australia. However, it must be noted that stroke incidence rates in young people of working age have been increasing over time. In 2020, it was estimated about 10,600 strokes, approximately 29 strokes a day, were experienced by Australians of working age. In 2020, about 6,500 or 25% of the total strokes occurred in people aged less than 55 years. This is an increase from 14% in 2012. If these trends continue, this is set to increase and may lead to greater costs due to stroke in the future. The epidemiology of stroke also varies by geography. Regional and rural Australians are identified as 17% more likely to experience a stroke. According to the National Stroke Audit Report, regional health services and their patients were also identified as having limited access to well-established standard stroke treatments, resulting in poorer health outcomes from stroke. These factors all have quantifiable economic and well-being consequences. Almost 70,000 people were hospitalised in 2020, costing the health system $714 million. The productivity losses due to stroke total $1.4 billion for those aged less than 55 years, compared to $1.5 billion for those aged 55 years and over. Informal carers, importantly, provided 39.7 million hours of care to survivors of stroke. The biggest impact of stroke is not the economic costs it causes, but the loss of healthy life. Of the total burden of stroke, loss of healthy life and well-being due to long-term disability and premature death accounted for the majority at $26 billion. The federal government bore the greatest financial and economic burden at $2.5 billion, and this is due to lost productivity, with survivors of stroke affected by reduced employment, absenteeism and presenteeism, but also the services funded by the federal government, including health system costs, the National Disability Insurance Scheme, and aged care services. State governments bore $350 million, mostly due to healthcare needs of people experiencing a stroke. Individuals and broader Australian community bore most of the burden of stroke. As mentioned earlier, this report demonstrates that there is significant value in investing to prevent stroke and improve access to timely treatment. Improvements in stroke prevention and treatment were modelled based on an assumed shift from current treatment to the national benchmarks provided by Stroke Foundation. Stroke Foundation consulted the latest evidence and experienced clinicians in ensuring these measures were achievable and had significant potential to improve stroke outcomes. The benefits of reaching the proposed national benchmark in 2020 were captured through savings to well-being, productivity, the health system, and to other financial costs. Each benchmark that was considered has the potential to improve health outcomes for thousands of Australians annually. These included improving access and timeliness to stroke treatment, that is for thrombolysis and endovascular thrombectomy. It also included reducing uncontrolled hypertension and increasing the proportion of people discharged from hospital who were discharged on antihypertensive medications. If these benchmarks were met in 2020, the expected benefits over the next 5 years from improved well-being and reduced mortality were estimated at $2.4 billion in net present value. Further, there are also notable economic financial savings of $179 million over 5 years in net present value terms. These benefits would accrue to government as well as society, in addition to Australians directly impacted by stroke. Around 4.7 million Australians have high blood pressure, this being a leading risk factor for stroke. Research provides evidence that 48% of strokes could be prevented if high blood pressure was eliminated. Lowering blood pressure has been conclusively shown to prevent both ischemic and hemorrhagic strokes, and it's equally important in preventing recurrent events. This report provides evidence that of the 6 improvements or benchmarks that were modelled in this report, reducing the rate of uncontrolled hypertension in the population from its present value of 23% to 17% would have the greatest impact, achieving a total saving of $1.3 billion. We have an opportunity to act now to stop this disease. If prevalence and incidence rates of stroke from 2020 were to continue, it's estimated that by 2050 there will be 819,900 Australians who have experienced a stroke sometime in their lives. This is an increase in 374,000 or 46% from 2020. An additional 23,000 people will have a first-time stroke each year. Economic and well-being costs of stroke will also increase accordingly. So advances in stroke treatment have resulted in significant declines in mortality, and better control of risk factors has resulted in reduced incidence of stroke. However, as quantified in this report, stroke continues to place a significant economic and well-being burden on our health, aged care and disability systems, the economy and the community. But it doesn't have to be this way. This report demonstrates there are potentially billions of dollars and many years of healthy life to be gained annually by investing in evidence-based actions to reach achievable benchmarks in stroke prevention and equitable access to timely treatment. Thank you.
Thank you so much, Mandy. I think there's a lot of very encouraging information in this report, clearly around reduced mortality, the opportunity for investment, and the reducing incidence. But there are some worrying trends in younger people, and that is consistent with what we have seen internationally. For me, I think the key takeaway is the opportunity to make an impact, as you've concluded. We know what good looks like across this country. We know what those benchmarks are and how they can be achieved. We know we can have a significant and lasting impact in stroke prevention and better outcomes for those who experience a stroke by achieving those benchmarks. Just to think, by reducing uncontrolled high blood pressure and improving access to emergency stroke treatments, we could change the lives of thousands of individuals annually and deliver potential savings of 179 million over 5 years and improve well-being and reduced premature mortality from stroke to the value of a further 2.6 billion. At a time when this country is facing its biggest economic challenge ever, that sounds like a win-win to me. The concerning trends in younger people are, as we've said, consistent with what we have seen internationally. And it highlights the importance of the Young Stroke project that the Stroke Foundation is currently delivering with funding support from the National Disability Insurance Agency. This project is co-designed. It's being delivered with and by younger people with stroke. and have already proven to be a revealing journey and exploration to understand the needs of younger stroke survivors and how we can partner with them to make their best recovery possible. And I know that some members of our Young Stroke Project team have joined us today. I'd particularly like to acknowledge Adrian O'Malley, who's just recently done a wonderful podcast for us. This report demonstrates more than ever, I suppose, the importance of working in this area and making sure that our system is meeting the needs of younger people like Bill, who are working age, that still have recoveries to make and that are determined to make them. Further, the National Strategic Action Plan for Heart Disease and Stroke provides a roadmap of evidence-based interventions to address stroke, including tailored resources and supports. Funded by the Australian Government, Stroke Foundation partnered with the National Heart Foundation, and I'd like to acknowledge that Kellyanne Jolie from the Heart Foundation has joined us here today, to develop this action plan in 2019. Many of the actions identified in the plan have been modelled in this report. We will now hear via video message from Minister for Health, the Honourable Greg Hunt MP.
I'm delighted to launch the National Stroke Foundation's report into the economic impact of stroke in Australia. And I particularly want to acknowledge Sharon McGowan, the CEO of the Stroke Foundation, Professor James Angus, the chair of the foundation, all of the employees and volunteers, all of the supporters, and all of Australia's researchers for stroke and cardiovascular disease. We know the challenge. In any one year, 10,000 lives will be lost to stroke. 27,000 Australians will have some form of stroke, and the short-term, 1 month fear of loss of life is all too real. That then translates to 445,000 Australians roughly who are living with and recovering from the effects of stroke. And some will be very mild, but some, as we know all too well, are debilitating and devastating. And what the Stroke Foundation is doing is helping to address those causes. But this report highlights the fact that, sadly, this $6 billion in direct costs in any one year and up to $26 billion in indirect costs of lost opportunity, of the impacts on families, of the impacts on carers. And so it's a very important report, and I want to thank Sharon and Jim and everybody who's involved. That then brings us to the National Action Plan on Stroke. And we've invested $4 million directly, and that's focusing on prevention, diagnosis, treatment, and education, all of these elements. In particular, 800,000 for the FAST plan. These are fundamental steps forward to changing outcomes in Australia. Beyond the plan, though, there's our research, and we've contributed over $266 million to research into stroke through the NH and MRC over the course of the last decade. And going forwards, there's $220 million for the National Cardiovascular Mission under the Medical Research Future Fund. And this has stroke as one of its principal areas of research. We've seen already that under the mission, through the competitive peer-reviewed process, $4 million was awarded to the Stroke Foundation to focus in particular on paediatric and youth stroke. Such a shocking, surprising, and devastating condition. And the work that the foundation is doing in helping to coordinate that research and to deliver better outcomes is really life-changing and I believe life-saving going forward. So I want to thank you and acknowledge you for that work. There's the work we're doing on helping people to live with stroke. Significant funds available there. But ultimately, it's about early diagnosis, it's about prevention, and it's about the immediate treatments. Treatments such as the program for mobile stroke units, which has been successful through the first stage of the Frontier Science program, which I launched with Jim at Essendon Airport. And I hope that this and other projects are successful in delivering widespread and significant nation-changing outcomes. So I want to thank everybody involved in the development of the National Costs of Stroke report. 6 billion and 26 billion directly and indirectly is an enormous cost. But it's the 10,000 lives, it's the 27,000 sufferers, it's the 445,000 people living with stroke who are the real focus of this. The economic is the outcome, but the subject is the people. And if in our research and your work, we can together achieve better outcomes, we will have done something that really matters. So I want to thank you and honour you and officially launch the National Stroke Foundation's National Costs of Stroke report for Australia.
I thank the Health Minister for his messages. As a bipartisan organisation, Stroke Foundation looks forward to working with governments at national, state and territory level to implement initiatives in the National Strategic Action Plan for Heart Disease and Stroke. The action plan is currently under consideration by governments and we hope to see it launched shortly. We've now come to the end of this event. Thank you all for your attendance today. I'd particularly like to thank our panel of speakers, Their Excellencies, the Governor-General and Mrs. Hurley, Denise and Bill Vernon, thank you so much for being with us today and sharing your story. It was just resonated with everyone here. Professor Amanda Thrift, for sharing those findings and for giving us all hope for what we can achieve through investment in the initiatives that we've modelled. And the Honourable Greg Hunt, MP, Minister for Health. I would also like to thank our Board of Directors for their incredible support in commissioning this report. I want to thank you all for participating in today's launch. I would like to thank the Deloitte Access Economics team for their diligent work in preparing this report. I also wanted to particularly acknowledge and thank Professor Thrift, Professor Nadine Andrews, and Professor Bruce Campbell, and members of our Research Advisory Committee for the many hours of work that they contributed to reviewing this data, to making sure that it was absolutely solid. We're an evidence-based organisation and we absolutely rely on the facts. On behalf of the Stroke Foundation, I want to acknowledge our sponsors, without whom this report would not have been possible. Boehringer Ingelheim for their support of the Economic Impact of Stroke Report 2020 and its companion report, No Postcode Untouched, Stroke in Australia 2020. Medtronic Australasia for their sponsorship of the Economic Impact of Stroke 2020. Bayer Australia for their support for the No Postcode Untouched report. For more on the reports and to find out more about stroke in your own area or any of our Stroke Foundation's work, please visit our website, www.strokefoundation.org.au. On the website, the reports are provided in full. We also have an interactive map that can be searched by postcode for localized stroke data. It also details how you can help to prevent stroke and reduce its impact on our community. As Mandy said, we have an opportunity to act now on this report, and I look forward to working with governments and you, our stroke community, to make a real and lasting impact. Together, we can change the course of this disease for generations to come. By reducing high blood pressure amongst Australians, developing stroke-equipped ambulances, ensuring equity of access to comprehensive stroke centres, increasing stroke unit care, we can improve outcomes from stroke and reduce its burden on communities, individuals and families. With increased focus on better secondary prevention, we can also help more Australians to live well after stroke and avoid hospital readmission. It's an investment we can and must make for the future health and well-being of the next generation. Finally, I cannot conclude any presentation or event without sharing the FAST signs of stroke. Using the FAST test involves asking 3 simple questions. Check their face. F stands for face. Has their face drooped? A stands for arms. Can they lift both arms? S is for speech. Is their speech slurred? Do they understand you? T stands for time. Time is critical. If you see any of these signs, call 000 straight away. Every stroke is a medical emergency. Every stroke is a 000 call. Just 16% of the population in Australia know the fast signs of stroke. Time saved is brain saved. The more people who know the fast signs of stroke, the more lives can be changed for the future. Please share these messages with your family, friends, and colleagues. Thank you again so much for joining us here this morning. And that concludes our presentation.